Hello, we'll be telling you about bacterial pneumonia. We are group A2. My name's Carter.
I'm Ansley.
I'm Avery.
I'm Callie.
I'm Callie.
I'm Caleb.
I'm Chandler.
I'm Ben.
I'm Brock.
I'm Brett.
Okay, so what is pneumonia? Pneumonia is a lower respiratory tract disease that is caused by an infection. This infection causes the alveoli to fill up with fluid. Depending on the patient and their condition, pneumonia can cause mild symptoms or it can even be deadly. Being able to understand the general information on pneumonia helps us to provide the best medical attention to patients. Certain patients may be more vulnerable to the infection than others. This means that as medical providers, we need to know the best treatment plan based on symptoms and their medical history. So the role of healthcare professionals based on the Christian worldview. There's two verses that relate to diseases. The first one, Matthew 9:35, says that Jesus went through all the towns and villages, teaching in their synagogues, proclaiming the good news of the kingdom and healing every disease and sickness. And then Psalm 147:3 says, He heals the brokenhearted and binds up their wounds. As healthcare professionals, our responsibility is to care for patients the best way we are taught to do. Considering we work with all kinds of people, we need to respect their decisions regardless of their religious beliefs. We can make a positive impact on the patients if they need any help. God calls us to love our neighbors as ourselves, and this is the best way we can do so.
Understanding how bacterial pneumonia develops is also very important. Bacteria are inhaled into the lungs or spread through the bloodstream, leading to infection. The immune system then sends cells to fight the infection, causing swelling and fluid buildup in the lungs. The general impact of health symptoms include cough, chest pain, fever, and difficulty breathing due to impaired oxygen exchange. This can lead to respiratory failure, sepsis, or pleural effusion, requiring immediate medical intervention. Some important pathogens associated with pneumonia are Streptococcus pneumoniae. This is the most common of bacterial pneumonia and is responsible for many severe cases. Haemophilus influenza is a significant cause of pneumonia, especially in individuals with underlying lung diseases. Mycoplasma pneumonia often leads to walking pneumonia, which is typically mild but can cause serious illnesses as well. And influenza virus, a major cause of viral pneumonia, especially during flu seasons, and can lead to secondary bacterial infections.
There's two main causes of pneumonia, but there's like several different ways to contract pneumonia. The first one is called CAP. It's community acquired pneumonia, and it's contracted outside of a healthcare facility. It's the most common one, and it usually has mild symptoms, and it usually develops from colds like COVID, common flu, or the cold or common colds, and then fungi and molds can also develop CAP. And then the second one is hospital-acquired pneumonia, and that's acquired in a hospital setting due to an illness or another procedure. And this one's usually more serious due to its antibiotic-resistant bacteria, and it's harder to treat. And then you can also get pneumonia from ventilator-associated pneumonia. And when if you swallow food, liquids, spit, or vomit go down your trachea the wrong way into your lungs, and if you can't cough it up, your lungs get infected with pneumonia.
Pneumococcal pneumonia introduction is a gram-positive bacterium that typically exists as a part of the normal flora in the human nasopharynx. However, under certain conditions, it can become pathogenic and cause serious diseases such as pneumonia, meningitis, and otis media. It is a facilitative anaerobe, meaning it can survive in both oxygen-rich and oxygen-poor environments. The global impact. This bacterium is a leading cause of pneumonia, meningitis, and bloodstream infections worldwide. It's disproportionately affected vulnerable populations, including young children, the elderly, and immunocompromised individuals. According to global health data, pneumococcal disease accounts for over 1 million deaths annually, with a significant burden in low-income countries where access to vaccinations and healthcare is limited. The morphology of pneumonia appears as a Latin shape, gram-positive diplococci. The polysaccharide capsule is its most critical vulnerance factor, protecting it from immune system clearance. It provides pneumocillin, a toxin that damages host cell membranes and disrupts immune response. Autocillin facilitates bacterial cell wall degradation, aiding in the release of inflammatory components that enhance infection severity. The bacterium is transmitted through respiratory droplets, making it easily spread in crowded environments.
Pneumococcal pneumonia signs and symptoms. After about 1 to 3 days, the signs and symptoms of pneumococcal pneumonia become present in the infected individual. These may include various related chest pains. Sometimes cyanosis, which is the bluing of the skin due to lack of oxygen, is present in the lips of the infected patient because of their shallow breaths and improper oxygen intake. A couple of the symptoms also can be seen in this picture expressed on the right, including the variety of shallow breaths, their loss of appetite, and chest pain. And depending on the individual's health prior to contracting the bacteria, the cases can range from mild to life-threatening.
So the pathogenesis of pneumococcal pneumonia is started by Streptococcus pneumoniae, and it's only seen when Streptococcus pneumoniae has a capsule because of the capsular polysaccharides and also the pneumococcal surface protein, which is also known as PSPA. Those are going to interfere with C3b from binding to the bacteria and causing opsonization. And pneumolysin is also releasing a pathogenic factor or virulent factor for pneumococcal pneumonia, as it can breach the membranes and kill eukaryotic cells, such as within the mucociliary escalator or between the alveoli and capillary boundary. And so that can cause alveolar flooding and hemorrhage, which will then provide nutrients for bacteria to grow within the lungs, and it also provides amine or escape, where bacteria can enter into the bloodstream. And from there, it can cause sepsis, infective endocarditis, or meningitis. And pneumococcal pneumonia infections will lead to inflammation from that pneumolysin, and that's going to lead to the accumulation of fluid and phagocytic cells, which results in difficulty breathing.
All right, treatments and outcomes of pneumococcal pneumonia. First, for treatments, antibiotics are important factors or treatments to treat pneumococcal pneumonia. Oral penicillin and amoxicillin or other beta-lactams are the first line of agents for mild / moderate disease symptoms. If the patient cannot tolerate or if the bacteria is resistant, alternatives include macrolides or fluoroquinolones to help treat pneumococcal pneumonia. In severe cases, whether in the hospital or ICU in general, antibiotics such as ceftriaxone, cefotaxime, and amoxicillin clavulanic acid are beneficial in treating the patient, and this is usually done through an intravenous treatment such as an IV. Antibiotic resistance is of significant concern, specifically with pneumococcal pneumonia. Some strains produce enzymes known as beta-lactamases, which was addressed recently in class by Dr. Kufrick. Bacteria with beta-lactamases are resistant to beta-lactam antibiotics such as penicillin, and that's why sometimes we need alternative antibiotics and why it is difficult to recover and effectively treat due to this increasing resistance. Vaccines are also a great defense in treating pneumococcal pneumonia. There are two main types. The first is pneumococcal conjugate vaccines, which an example is PCV13. They're beneficial for children, the elderly, and immune-compromised people, as these vaccines elicit a strong immune response in children and provide a specific and overall protection. The other one is pneumococcal polysaccharide vaccine, PPSV23. This vaccine has a broader range and does not have as strong as immune response for children, but is typically administered to high-risk adults. Other treatments that may seem trivial but are greatly beneficial to treating pneumococcal pneumonia are staying hydrated with fluids, eating healthy, and giving your body the proper care to support the immune system. One example that we discussed in class was when Dr. Kufrick had tuberculosis. Honey and tea was a great support to help her fight against the bacterial infection. No antibiotics were needed. This exemplifies how this sort of treatment is just as important with pneumococcal pneumonia and practically any sickness. And also, if needed, the use of pain relievers to alleviate symptoms of discomfort can be used as well. So outcomes and complications. Most patients do well and are cured with symptoms of the treatment. Being symptomless and getting rid of the bacterial infection depends on age and pre-existing conditions. But these symptoms can only could last a week to even 3 months. But as Dr. Kufrick said, even if you don't show symptoms, it always takes time for your immune system to recover, and that could take from a month to a couple of months. If pneumococcal pneumonia is serious enough, respiratory failure, sepsis, meningitis, and empyema, which is like fluid around the lungs, which can be seen in the figure above, can show the impactful complications. Overall, the mortality rate of pneumococcal pneumonia is 5 to 7% of hospitalized patients with older and immune-compromised individuals with higher risk/rates. In general, pneumococcal pneumonia can be treated successfully with antibiotics, but prevention through vaccination and a healthy lifestyle is the best treatment, especially with today's rise of antibiotic resistance.
Klebsiella pneumoniae is a gram-negative bacterium that belongs to the Enterobacteriaceae family. Being gram-negative means that it has a thin peptidoglycan layer in its cell wall and an outer membrane, which is important in its ability to resist certain antibiotics. It's part of a group of bacteria that naturally exist in the intestines and other parts of the body, but under certain conditions, they can cause infections. Bacteria thrive in environments where the immune system is compromised, which is why Klebsiella pneumonia is more likely to affect patients who are immunocompromised, which means that they are more prone to certain viruses. Klebsiella pneumonia is primarily known for causing pneumonia, which is a severe lung infection. However, it can also infect other areas of the body, including urinary tract infections, bloodstream infections, or wound infections. Some common causes are that the bacteria can be inhaled from the environment, particularly in hospital settings where the bacteria are most prevalent. Post-surgical infections and wound infections can also provide a pathway for the pneumonia to enter the body. Urinary tract infections also is a common cause, particularly in patients who are catheterized, are common sources of infection. Some risk factors are chronic lung disease, which makes individuals more susceptible to pneumonia caused by Klebsiella. People who are immunocompromised, as mentioned before, like people going under chemotherapy, organ transplants, or those who have had HIV or AIDS are at a higher risk of infections. Recent antibiotic use can disrupt the natural balance of bacteria in the body, allowing Klebsiella and other opportunistic pathogens to take hold. Mechanical ventilation is also a risk in hospitalized patients. These patients on ventilators have a higher chance of developing pneumonia because the ventilator can introduce bacteria into the lungs. And then another risk is just age, and the older you get, the weaker your immune system gets, and more susceptible to Klebsiella pneumonia.
Like Brett said, Klebsiella pneumonia is a dangerous gram-negative encapsulated bacterium that causes severe pneumonia and also bloodstream infections. It's responsible for a range of serious symptoms, and its pathogenesis involves several mechanisms that help it evade the immune system and therefore cause tissue damage. The symptoms of Klebsiella pneumonia are quite severe. Patients often experience high fever and chills, along with like a productive cough that can be known to produce like a thick, bloody sputum. It's also described as like a currant jelly. Chest pain and difficulty breathing are common, as mentioned earlier, and patients may feel extreme fatigue and weakness. Like Carter also said earlier, in severe cases, this infection can lead to lung abscesses and pleural effusion, which are serious complications that require prompt medical attention. For treatment, antibiotics like carbapenems are considered the first line of therapy. However, in cases of the multi-drug resistant strains, alternative antibiotics like polymyxins or tigecycline may be used. Antibiotics like cephalosporins and aminoglycosides are also options for like the less severe cases. Supportive care such as oxygen therapy or mechanical ventilation may be needed to stabilize these patients. Klebsiella's ability to colonize and cause infection starts in the human gut, but it can spread to the lungs through aspiration, contaminated hands, or medical equipment, as a few have already discussed. Its thick polysaccharide capsule helps it evade the immune system by resisting phagocytosis and complement-mediated killing. The bacterium also produces lipopolysaccharides, or LPS, which protect it from immune recognition and provoke the severe inflammation. As the bacteria invade lung tissue, they produce enzymes that lead to tissue destruction, causing necrotizing pneumonia, abscesses, and again, the pleural effusions. In the worst cases, Klebsiella can enter the bloodstream, resulting in sepsis and multi-organ failure. In conclusion, Klebsiella pneumonia is a highly dangerous pathogen that requires prompt and aggressive treatment to avoid these life-threatening complications. Early recognition and appropriate antimicrobial therapy are key to improving the patient outcomes of those who suffer this pneumonia.
So I'll be covering Mycoplasma pneumonia, also known as walking pneumonia. It has its name due to its mild symptoms. These symptoms are early on a dry cough, which is its staple symptom, a sore throat, fever, and a headache. These last typically 1 to 3 weeks. Later on, this can turn into fatigue, muscle aches, and chest pain if the disease continues. The pathogenesis for this is that it attaches to the respiratory cells, disrupting cilia and P1 adhesion. And due to it lacking a cell wall, it's naturally resistant to P-lactam antibiotics like penicillin, which makes it harder to treat and to gram stain. Comparing it to the other types of pneumonia like streptococcus or Klebsiella pneumonia, it's different because it has that gradual onset and mild symptoms like the persistent dry cough, making it relatively not as bad as the other types. And it's typically treated with macrolides. And like I said, the outcome of this is typically with treatment 1 to 3 weeks of a dry cough and a sore throat, and then you're back to being fine, with the worst cases sometimes needing hospitalization.
And here are our references.